Begin.
Good morning, everyone. Welcome to Breakfast with WACh, which is always great for those of you in the virtual environment. You're missing out on some really good donuts. So sorry. My name is Judd Walson. I'm one of the co-directors of Global WACh, along with Grace John Stewart. And it's my pleasure to introduce our two speakers today. I have to, I'm a little bit embarrassed about this, but I've finally reached the age where I need reading glasses, and I've been resisting, but I'm going to put them on for the first time here. Our first speaker, so first of all, the topic of the conversation today is empowering rural women in India, breaking down barriers to healthcare access with anonymity and technology, a user-designed approach. And our first speaker will be Sushma Kallam. She is an Indian engineer and IT consultant who created an award-winning film documenting the impact of global supply chains on rural populations in Andhra Pradesh. She left the corporate world and moved back to South India with her family, where she lived during the height of the COVID-19 pandemic. And while there, she observed that many Indian women were disproportionately suffering due to language barriers, lack of awareness, preventing them from accessing existing healthcare information. And because of her amazing, very varied background, she developed the WOW, World of Women, an Android application that provides legitimate doctors' information in local languages through audiovisual form and allows users to record their concerns anonymously to protect their identity. And then following Sushma's talk, we're going to hear from Dr. Susie Ramisetty-Mikler. She is a research associate professor in the Department of Population Health Sciences and Epidemiology at the School of Public Health at Georgia State University. Her research focuses on interdisciplinary collaboration with researchers in areas associated with the health of women, children, minority, diverse, and vulnerable populations. Her primary focus is on women's health, including prenatal, postpartum, and birth outcome research. So please join me in welcoming our two fantastic speakers, and I'm looking forward to this very much. Thank you so much, Sushma.
Did.
Okay, so can you hear me now?
Yeah.
Okay,
Fine.
All right. So thank you for that wonderful introduction. So good morning, everybody here who are in this room, but good afternoon, good evening to people who are joining online, because I know there were a few people that were joining from India. So great to be here. I thought I would start today's presentation maybe with a little story so that we can all be connected with stories. All right. So the location of where our story takes place is Southeast India, in a district called Visakhapatnam, aka WACh. So there is a small little village called Kondakarla. So in this village lives Bhavani. She is about 50 to 55 years old. She doesn't know exactly her age, which is pretty common for the population in that region. She is a vibrant woman. That's why I chose that photo. She's like a lively person. She likes to have fun. She likes to play with her animals. And she is a farmer, well-respected farmer in the community. And the reason I choose this story is to connect us that the people we are talking about are people like us. It's not like these are people that are really like, don't have anything, don't know anything. No, these are well-respected people. So Bhavani is a vibrant person of the community, and suddenly she starts to lose weight and starts to feel really tired in doing her day-to-day chores. And then she has vaginal itch, which she cannot share with anybody because of the taboos in that region. So her family starts to think that because she has loss of appetite, her family starts to think that, oh, it's because she's not taking care of herself. There is no self-care. That's why the situation is not getting better. So they are getting frustrated with Bhavani that she's not taking care of herself. Then in the meantime, Bhavani is thinking that because she's a farmer, she takes her water buffaloes to the nearest lake. That's what water buffaloes like to do. They like to be submerged in the water, especially when it's hot out there. So when the water buffaloes come out, generally what the farmers do is they wash them a little bit. So they're clean and they come back home. So at this time, at one of these times, she falls in the lake while trying to clean the water buffalo. So she is internalizing that the condition that she's going through is because she fell in the water in the lake and there is something bad in the water that has somehow gone into her body. So that's how she is internalizing. And she talks to her husband, but the husband himself is busy with his daily chores, like the farm, the animals, and the daily work. So he's like, and also in these communities, once the young kids grow up, the husband tries to transition the responsibility to the son and say, take your son and go check with the doctor. That's the support that he provides, not any more than that. So the family is increasingly getting frustrated with her that she's not taking care of herself and then lacking in the household work. And the husband is like, please go with your son, go to the hospital, do whatever you need to do. And in the meantime, she does not even want to go out because of her vaginal edge. It's like public shame. She doesn't want to be out there scratching and all these things. So she starts to avoid all public events. Now, as we all know, a lot of women in these communities, they, like Bhavani, they would prefer to face the pain rather than feel the shame. They feel the pain, but rather than be coming out and then go through whatever the shame that the society has. So she has to depend on her son to go to the hospital because the hospital is nearby, but she would never, ever discuss her private concerns with a young son. So she shares with a couple of women in that region who she trusts in the community, and they tell her some home remedies like, okay, maybe do this, maybe eat yogurt, or maybe do this and that, or some witch doctor related stuff, which never helps her. She continues to feel the problem. And then the option is to go see a government hospital. The issue with the government hospitals is while India is really trying with the government hospitals while putting all the resources there, the doctors go on field trips. And especially during COVID, the nurses, A&Ms that are there, they're burdened with so many other programs and they were not allowing crowds. So people like Bhavani who go, they would have to wait or they would be sent back home to come the next day. Because of that unreliability, she hesitates to go or she doesn't reach the government hospital, which is near her village. Now, the private hospitals, there are private hospitals, of course, but the reality of private hospitals is they're oftentimes in the nearest town or city somewhere. And in order to go there, you have to take some transportation to go reach that. And somebody has to go with them, either the son or some grown-up would have to give them company, which means whatever the work they're doing, now two people's work has to be cut out to go to these hospitals. So there is loss of work. And then even when they go, they have to wait in these long lines in these hospitals and then go check with the doctor, get the medicine. And by this time, half a day is passed. So get some food and stuff and then come back. So there is a dollar amount associated with that, even though it says only $12. It's a significant amount of money for this population. And the day, more than the money, for them the time, because if Bhavani leaves, who is going to take care of the animals? Who is going to feed them? Who is going to milk them? And apart from all the house chore works. So all these things combined together, contributing to Bhavani avoiding. So I heard this terminology recently from a physician called healthcare avoidance. So they fall under the group of avoiding healthcare until it becomes an emergency. So then one day, because I lived in this village when I was going to my own farm project that we were working on, I would oftentimes ask her, hey, how are you doing? She would put up a brave face and say, I'm doing fine, but I don't want to pry on her because even though she seems to be losing weight, I don't want to pry and say what's going on. But because I'm not from that community, it's not like I have my family or anything there. I'm not part of the community. So anyhow, I keep asking her. One day, she confides, when there was nobody, I was walking through the farm, she confides her situation that she tells me her conditions. I immediately called my friend who lives in the nearest city, a gynecologist, and explained to her that she has loss of appetite and she's feeling extremely tired and she has a vaginal edge, all these conditions. When I explain, my friend, Rajni, she says, she needs to get her blood work done. Losing weight suddenly like that is not something is normal. It's not like because she's not eating food, it's happening. So she needs to get it tested. She needs to somehow get her urine test and then blood work done. When I talk to her and I say, you need to talk to your son, she refuses. She's like, I would not do that. She starts to even pass out sometimes because when she tries to go in the sun, tries to work, she starts to pass out. So then I talk to her son without explaining her condition in general, like, it seems like your mom is feeling weaker. Why don't you just take her to the hospital? And COVID has complicated all of this situation. So anyway, after 3 months of waiting, she finally gets diagnosed with diabetes. So she has been suffering with that for 3 months. And I'm sure most of us can, even though we can't relate completely, can understand the pain this person must have gone through and the effect it has on the quality of life. And the reason I chose to tell this story is because it's not a story, one-off story of Bhavani. And that's why I choose that particular person. There are millions of women. And you guys would have to forgive me. This is not the situation that happens just in India. Here in this country, with all the resources, with all the money, we still fight for women's health issues. So this is the situation that happens pretty much globally everywhere. Millions of women suffer with so many various conditions. And all these things, now going back to India, government, of course, is trying. It's not like they're not trying. They're definitely trying. But it's overwhelming for the government also to take care of all of this population. To tell a small offshoot story, there was Lakshmi, she was bitten by a snake around 6:30, so it's a viper. So we encourage her because it's right next to our farm. We tell her, you really need to go because it could be viper at this time. She goes to the nearest government hospital and it was closed because by the time she milks and goes, it was like about 8 o'clock and the government hospital is closed. So they ask her to go to the CHC, which is in the nearest town. And in order to do that, now she's scratching for how do I get there? Because it's nighttime, the public transportation is not there. Now, who is going to help her, take her? So all these things. So it's not like one of a story. Millions of women are in the place that we are talking about, which I'm sure you guys are all familiar with. Now, I come from the corporate big tech background. Now, the question immediately I'm getting when I'm looking at this is, why isn't there a technological solution? We have technological solution, for God's sake, with Amazon that is reaching these villages. So why isn't there some solution that this population can utilize? So I was just starting to think like that. And one of the reasons is obvious. Commercial apps need to make money. That's the premise of the commercial apps, which means their focus is on making, like, how do we convert these users into consumers? When you are converting that, one of the things that's important is this population are not like consumers. And there are many apps that you can create if you have that knowledge to make money. So somehow this population seems to be left behind. So one day I trying to understand this problem, I tried to take WebMD and translate that into the local language completely and try to show them that, hey, here is the information for your symptoms. What should we do? And the way the information is written is hard for them to comprehend because they don't have any healthcare background. They don't understand who is a gynecologist, who is a pediatrician, who is an oncologist, who is a female health specialist. That's not how they're thinking. All they're thinking is, I have pain in my head, I have pain in my chest, or I have vaginal itch. That's the only way they are able to think. So it gets complicated, more and more complicated. In the absence of this gap, younger women are increasingly resorting to YouTube or Instagram or Facebook, wherever they can get the information that can help them somehow. So that shows the desperation too. They're trying to hold on to whatever that comes in their way. And now I talked to my friend here at Virginia Mason, she's a doctor. She told me that the bane of my existence is this online diagnosis because people will come to me and say, hey, I have this problem. Can you prescribe medication? And she's like, I don't know if you actually have that. And then they put up a fight with them because I put my symptoms there and this is what came out. So you're wrong. So can you give me medication? So you can see how in the absence of a proper platform, what these platforms are doing, either misdiagnosis or causing delays in getting the care that they need. So what does all of this mean? Millions of women everywhere, sometimes quietly suffer. Then comes the big question. Does that mean technology is the solution? That's the big question we all have to ask, because I left big tech thinking we are actually going in the wrong direction, overusing this technology everywhere for everything. And today, if we sit here and if we raise concern that the AI is going rogue, then we all have to ask who is allowing that and why is it coming there? So I left that field. So I'm hesitant to use technology for populations that are not there, because I am not concerned, I'm not convinced that particularly we are making good progress even in the societies, in the Western societies that are way more tech savvy. So how do I understand? Then I was like, okay, what do we do? Because we are living there. This is during COVID and we are living there. One of the things that we did is we went door to door. The first thing we did is to understand what is the extent to which any technology is being used in these populations. So, for example, we had a survey, like, do you use your cell phone for any other purpose other than just calling? If yes, what are the purposes that you use it for? Is it for what kind of programs do you see? Overwhelming majority of the population said they use YouTube because they watch all their serials, whatever they get, because there is no TV independently, and the TV is primarily controlled by the male of the family. So they resort to this YouTube where they get all these serials. So they're using YouTube, and the younger generation are using Instagram. I was so surprised that people in the village, 18-year-old, 19-year-old, 20-year-olds who don't even come out and talk, who are so shy, because it gives them some sort of privacy to just record themselves, they are using Instagram. So these are the applications that Facebook, Google, Instagram, these are the applications that they have been using. So then we conducted an experiment to do, how to determine whether technology is the right solution or not. So the experiment we have done is we have conducted medical camps, and the other set of group of representatives went door to door using the cell phone for the teleconsultation, just to see how in these populations they're going to accept or not accept the technology. Many people came to the medical camps that we have conducted. Many older people came to the medical camps we have conducted, because that is along with the lines that they already know, the system. Many younger population, they preferred to be home and do talk from the privacy of their homes, because they are getting exposed to this technology and what it can do. So they were like, so you can see the divide very clearly, that the older population towards the physical presence, and then the younger population towards technology. But the physical things, medical camps we were conducting, we were analyzing, we were getting into issues of, we have to bring all the doctors to the medical camp. We have to bring all the healthcare professionals like nurses and healthcare staff to the camps. We have to get the medicine and everything to the medical camps. So, and if it is sunny, then we have to provide some sort of, like, they're all waiting in the sun, and we have to provide water and stuff like that. If it is raining, there needs to be a shelter. So you can see the difference between the physical presence versus, for simple things like information, we were seeing that they were using the cell phone, the younger population. And another key finding we did is older women, though they themselves would not like to use the cell phones and technology, when there is a younger member in the family, and that younger member is telling them, just tell me what your concern is, whatever, they were willing. So that was another key finding that we did, that if there is a bridge for this accessing technology, I think there could be an opportunity. And I was thinking again, yes or no. I was thinking about like how Buddha said, middle path. Yes, it's not this extreme or that extreme, but middle path. So what does that middle path mean? First, trying to understand, now going back to Bhavani's story, trying to understand, why did Bhavani choose to confide her situation to me? The situation which she would not even share in her community, other than 1 or 2 people. So if we focus on that, so then, like, again, as I said, like, because I come from the big tech, I'm like, okay, let's break it down into user requirements. What is it that made her come? So the first thing is, I was there walking back and forth to the farm, through her farm, meaning access. Access is the key. And for that, cell phones right now, most people have cell phones, even in rural villages, because COVID meant that most schools went online. So in the schools, all the schools went online. So they had to get like a smartphone. And also the government itself was coming up with programs like Arogya Setu, e-Sanjeevani, and these apps they were trying to come up with. So the population had to get phones. So that not everybody, but there is a significant amount of population that has these smartphones. So access, that cell phone having that, they can access at any time. The biggest thing, why would she choose to talk to me? And my husband, of course, he's a man, but he's a Caucasian. Why wouldn't she talk to him? Because language, it's like even just to say hi, hello. So language is one of the biggest barriers in accessing these platforms. A lot of information, there is so much information, good and bad, is available online. However, how much of that information can be accessed by people who do not speak English primarily? How much of that information can be accessed by people that have technology barrier, that have awareness barrier of whatever the language is explaining? So language is the biggest barrier. And in all our hundreds and thousands of interviews, what we identified is it has to be audio visual. That is the only way this population would be able to at least be able to understand that visually, if you can talk to them, and audio wise. So, and in whatever the information provided should be in the local language. Then as we talked, privacy is the most important thing. For that, what we did in our technology is, in our app is, we made it anonymous. If they choose, they can be anonymous. They can leave their concerns, they can check their concerns, and we would not know who that is, because the app is not intended for like making money, digging data from them. So that's the key. If most apps have login details, and for a reason, I understand why they have that, but anonymity is a key feature to engage this population. Then the next thing, why would she talk to me? I look like her. I am not somebody coming from somewhere. Maybe I'm wearing different clothes than she's wearing, but I look like her. That is another key factor for people to trust. Otherwise, she would never be able to come out and share her concern. So because of that, all the content we are putting in our app is created by local people. It's coming from the doctors, but the presentation of it is by people who look like Bhavani, not people who look different. So that's another key factor. No fear of judgment, like they don't want the judgment factor, so the technology cannot judge. It does, but not that particular piece. And the another thing that is really important is breaking it down to her level. What does that mean? And you guys would have to forgive me again, no disrespect even for the tech community. If I talk in some tech jargon, it would be hard for people to understand. So if we talk in some healthcare specific terminology, it would be hard for this population to understand. It has to be in simple terms that they can comprehend. If I say your liver, the diabetes you got because your liver is not processing, she doesn't know what liver is, or she doesn't know what part is. So the information has to be broken down, almost like you are telling it like a 5-year-old or somebody. And trust in knowledge. So meaning she approached me because she knew that if I don't know anything, at the very least, I would not cause her harm. Meaning I would not lead her down the path of saying something like, oh, this, you do that. That trust It has to be. That is what is missing from the online platforms. If you go to Google, Instagram, Facebook. So all the information that is provided in our app is again provided by certified medical professionals. Next thing. This is another really important factor, co-creating. Now I'm starting to think this, the population that we are working with as my users. Like for example, when I was working for Microsoft, we have these user requirements gathering, user meetings, and you co-create. So then I thought we have to co-create with them. It's their requirement. It is what they want. So the interface, how should the interface be? We have technical team here, the designers who are well-versed with what they're doing, but we will have these extensive meetings with rural women. So there will be a meeting, online meeting, and our representatives will be there. I'll give you a couple of examples of what the co-creation has resulted in. For example, we thought we should ask them when they're coming to the app to greet them like, hey, how are you feeling today? Represent how you are feeling today with like a smiley face and sad face with a slider. When we give that to them, they were moving the slider and they were like playing it like a game. Hey, look at this face changing to this face. And then we said, but you have to tell us how you're feeling using that. And they're like, how can I tell how I am feeling by changing this face to that face? So there is that lack of connection. That's not how they express how they're feeling. They don't express with a smiley face or emojis or things like that. And then the next, another example, this is a great example. For feedback, we were coming with the traffic light signal, like red, yellow, green. So we said, if you're satisfied, say green. If you're not, like it's okay, yellow and red. And they were like, again, like, how can you tell whatever you are feeling with a color? How is that representative? So this is why it is critical, important to understand at their level. What is it that they are taking it out, even though it may seem intuitive to us, but that's not how the population expresses. And then we came back with, when we were asking them to express their concern, as I said, they were like, we can tell you where we are feeling. That's about what we can do, but we cannot, meaning they did not know how to express more than that. So we came up with a mannequin, female mannequin, to say, okay, click here, or click here, whatever the part, just like the body part where your pain is. It has to be that simple. So we co-created, and the content, when we wanted to get to the content, we talked to them. What are the things that you could use this technology for? And what are the things you would not? As I mentioned, trust is a key factor. They were coming up with some symptoms, but not seriously private exclusive stuff. We are still working on that. So they are coming up with, okay, for pregnancy, because that is something they can share. It's okay. So I would like some pregnancy related information. I would like some periods related information. I would like some nutrition related information, things like that. We are still trying to work this population to break that barrier, to get down to what exactly that we can help them with. And then we have conducted a lot of surveys and tested with multiple people. So I think you probably are also getting tired of hearing me. So here is a promo that we have done in India, but please, this is for Indian audience, done by Indians. So please do not pay attention to the grammatical things or the audio quality. That's really bad, but just to give you an idea.
When it comes to providing healthcare to its citizens,
Sorry, let me start.
India is rated as a poor performer when it comes to providing healthcare to its citizens, especially women, despite everyone's best efforts. Whereas it is the second among countries in using smartphones. Our vision at WACh is to bridge this gap and provide health information even to the remotest corners of the country using technology. World of Women is an app that focuses on women's health. Among its special features is that it provides essential information that some people in India still consider as taboo. The app has many components that provide information on health and well-being. Girls or women of any age can check for health conditions by selecting the concerned body part and the symptoms they have. That will lead to a video where the health condition is clearly explained, and our experienced panel of doctors will provide you with content. The app has an option where you can record your concerns, and we will get back within 2 days with healthcare suggestions customized just for you. Not just suggestions. You can connect directly with the doctor at a scheduled time to learn how to deal with your medical condition. Plus, easy to navigate period tracker helps to know details about your blood flow, period dates, etc. And in the future, we will send notifications about ovulation, best time to conceive, and other factors related to periods. We plan also to add soon a pregnancy tracker, dietary information, artificial intelligence assistance, and other features so that no woman in India will need to remain uninformed when she has a problem. This is the world of women we emphasize, and this is our way of contributing to the welfare of the women of India.
So that's just like a small promo, but I hope that that gave a little bit of idea about the features that we have, like how the information library is organized. How do we reach multiple people with this? So whether Bhavani is living in a village, whether she's living in a town, whether she's living in the city, we need to be able to reach people anywhere to provide the platform. And then the key factor, as I mentioned, I'm stressing that the basic services have to be free. If not, they're not going to use it because they're not people who are going to spend money on the app. Maybe once you gain their trust, once we start giving personalized information, like, okay, for your diabetes, maybe this is what you have to do. Maybe that could be a different story, but the basic services have to be free. And login credentials, like even most of the government apps do that. They're not going to get into that. They don't even know. Like, for example, in India, you have to scan something called Aadhaar card, which is like a state ID. Some of the population, they don't even know what their Aadhaar card. It is their kids that keep track of all these things. So they're not going to be able to enter their details and all the age. And age is a factor that is a requirement in login. Most of this population don't know what their age is. So login credentials would be hard for them to navigate. Now, there are thousands of apps, if not hundreds of thousands of apps in this world, like so many. It's inundated to the point, I think it is getting to the point of like annoyance with all these apps and stuff. But one silver lining with this population is, luckily, and I hope it stays that way, they are not inundated with apps because they are still not seen as consumers completely. They are, of course, we are trying, but still they haven't become complete consumers the way we are here. So that there is still some scope there. So how do we reach this population? Word of mouth is the best way to reach this population. However, how do we get to the point of word of mouth? Which means we have to go through the channels that are already established. There is no point in reinventing the wheel. I can gain their trust maybe in the next 10 years or 20 years, but there are organizations that have already done work to work with this population and have gained trust. So what we are trying to do is we are trying to partner with local organizations, and we are trying to do that at different layers. One, with nonprofits and private organizations that are already working in the community. Nonprofits specifically and the private communities, they have more say in what their members can do. And then educational institutions, that is really a key. Because most of research, like here at the UW, most of research comes out of the educational institutions, and they work with the community to come up with the programs and the research. So we are partnering, like these are the top universities, like Andhra University, some of the top universities in Andhra Pradesh. So we are trying to partner with them. And the next one, no matter what we do, we cannot get to the scale of where we want to reach without the government's help. So we are trying to partner with the government agencies like National Service Scheme and stuff like that. Quickly, a quick view into the results. This is directly from the Google stats. And if you can see, look at the numbers. We have about 2,000 installations because we are trying to do it controlled and we are just releasing it, like we are just coming out with that. But look at the number of times they are using the screen. it's almost like, I'm not sure if you guys remember, there was a study conducted with iPads that were left in some of the African countries to see how, without explaining anything, like the iPhones and iPad things, and they kept, they were able to even break the code and figure out things which was not even intended by the engineers here from the tech world. That's because when you give something, they are curious. The population there, they still have that intact, which we may be losing because of the technology. So you can see just from 2000 population, look at the numbers, like 169,000 times the screen has been checked or clicked to understand what that is. And then if you break it down by the screens, like 40,000, or the user engagement, 44,000. So this is an indicator that if we can provide it in the way they understand, maybe there is a chance to reach this population. So now we have some results that come out of our research, and I'm going to transfer this to Dr. Mikler from Georgia State University to go over some of the results. Susie, can you hear me?
Yeah, I can hear you. Can you guys hear me?
Yes.
Oh, perfect. Okay, so what I'm going to present to you is some of the data that's been collected for the past 9 months. And then what I got out of that, just looking at the queries that were made by women. So basically, there were 2,000 installations, total entries of queries 980. And since it started in July 22, last year, so this data represents like a 9-month data. So, and also analyzed until April 2023. So one thing that I realized that there is no gender and age because they are not required to put in any personal information. So we do not know who is asking. So, so far we have about 30% doctor consultations. So can you have a next slide, please? So what I did was looked at all the text data that's been inputted. And then what I came up with is categories that they were looking into, different inquiries, what are the patterns that they come up with. So I basically noted that menstrual health is #1 importance to many women, and also postpartum and pregnancy issues. So if you look at it, experience of stomach pain, why does it happen? Vaginal discharge and itching before and after periods. So there are several detailed questions they can ask, which they can never share with anybody else. So that was a very indication of they are open to telling us what private parts they can share that information. And also mostly concerned about irregular periods and the back pain related to menstrual periods. That's a very important topic. I realized that menstrual health particularly probably tells us younger generation or younger group, younger girls generation, mostly during the childbearing age, probably are using this app. So the related to pregnancy and postpartum, they had several issues concerning bleeding, and the bleeding occurs why if I eat papaya. Papaya is a fruit that's very common and in India, so largely consumed. So, and also breast milk concerns. How can I increase my breast milk? So these are typical questions that women, portrayed, and then they're interested in and inquiries. Next slide, please. And not only that, there are some pediatric care questions that showed up: itching, rash. So these are pretty common. Stomach pain, cough and cold. Most of the ages that I was looking at, I mean, not everybody is required to include age group of their children, but some of them did. So they kind of spanned between like 4 to 4 years old, or maybe infants, maybe child and school age group. So it's not older kids. So these are the common problems they are concerned with, looking at how to handle these health problems. Next slide, please. Now, not only that, there are other general questions that I came across was after COVID. Apparently, this was launched during the COVID. So there are questions about booster dose. Why does it hurt? Or why did I get temperature? Those kind of COVID-related questions. And also there are some pain questions, cough and cold. And I was surprised to see depression. They even knew the terminology, depression, sleeplessness. So there is some interest in addressing mental health issues in that population. As a public health person, that I was very impressed that they could ask mental health questions. And also there are a lot of thyroid questions and then weight gain questions. So these are pretty general adult women population concerns that I came across. Next slide, please. Now, at this point, I realize there is also a tons of data that come up with that we could look at, looking at the impact of the app or impact on the population. One of the things that Sushma shared with me was usually in the beginning, it took 2 days on average. And as the database was building up, the response can be immediate. And for the questions that are already being asked. So this is the back end of the AI application can categorize and consolidate information and provide on-demand answers if the similar question was asked. So that is a big deliverable I can see as a public health person, how we can use to improve that information that's actually fed by the physicians, experts in the field, which is very legit rather than Googling into WebMD or something like that. So this is to the point, very clear and very simple language provided to the consumer. And the other one is, I was thinking about impact of the app. How can we figure out? So apparently there is a small questionnaire that's been developed by Sushma and their group. They basically, at this point, I think they are being collected on paper pencil. So this need to be inputted into the computer, and then I could analyze these data. Basically, the questions were asked is, what was the health condition that they had? What did they do with it? What kind of inquiry? And they also asked about the response that they received. Was it helpful? If it was helpful, what was the specific thing that they did? And if it is not helpful, how is that? How can they improve to make it better in terms of giving information or consultation? And also, there's another question. If you did not receive information from the app, what would you have done to take care of the health problem? I think this is a very important question for me as a public health person. What would the alternative things that they could do? And this is where the gap is, I think. So first choice was ignore the condition. That's where we want to catch the population. If we don't want them to procrastinate taking care of the public health concern or personal concern. So ignoring the condition or go to hospital or use over-the-counter medication. So I would be interested in ignoring the condition and how we can help reach this population so that we can help them in improving their health condition. And also there was a specific question on how did you like the app, particularly in terms of certain features that were provided, like audio recording, anonymous feature, or free doctor consultation, or symptom checker, or health tips. So they could choose any of these so that we can see where the most information is helpful to this particular audience. So what I realize is it depends on, this app can be customized for any population. So we can provide information that based on the inquiries that are provided. Next slide, please. So at this point, of course, we are looking for funding and we are working on a couple of grants. And in one of the application, we are trying to develop iOS version. Right now, I think the app is available only in Android. So at Georgia State University, in collaboration with Public Health, where I am, and also computer science, we are developing an app that in iOS platform, so that and also focus first to build the app. Only English is the primary language, so we are going to pilot test it using the English language, and then later on can be converted into any language, or even to the population that may not read or write. So that is a big expansion that we are planning to do. And of course, we want to do the field application. At this point, we are discussing with several nonprofit organizations, particularly domestic violence. There is I'm in Atlanta, so we have a large group, a nonprofit organization, Coalition Against Domestic Violence, where a lot of women are represented by from the different communities. One of the bigger communities is the from population from Southeast Asian communities, includes India, Bangladesh, Pakistan, any Southeast Asian countries, Sri Lanka. So Raksha is the one of I'm targeting Raksha because one of the primary interests of mine is also prevention of domestic violence. And the other groups also, we have food pantries, Food Bank of Atlanta, and there's another one. The other communities we are looking into is LGBTQ communities, where we can customize information. So we are interested in any group that we can reach, which is totally underserved or some kind of taboo situation. So this app I can see potential being used in those communities. Next slide, please. Sushma.
So, yeah, like in the interest of time, because I know we have to leave soon. So the lessons learned, and I'm sure most people here can identify with these things. One of the hardest things to do is breaking down the cultural barriers or taboos. It's not like I just go and say, hey, when you are bitten by a snake, why are you going to the local witch doctor? You should go to the hospital. That's not how they think. And we can't assume that just go and say, and then they will listen. That has been really, really hard. The only way we can reach them is over the time by building trust. And then trust, people have to be able to relate to somebody to trust. It cannot be some outside person going and telling them. I noticed that that's also harder for them to overcome. Then local people, hiring local people, all the tests we were doing, all the surveys we are conducting by somebody who is in that community, so they can relate and they can understand. Otherwise, sometimes actually we send someone from one location to some different place, and they came up with 100 responses written by the same person. Just like, why did you write all those responses? Oh, they don't know how to write, so either. So then how do I verify whether that is real, or did you made up the numbers? So that's why it's critical to engage people in the community, because then they know the community, they know what to do. And all these things, I'm sure you know. Hand-holding is in the sense when we are trying to expect this population to get into a system that's different than what they know, we need to be able to guide. So every screen in the app has an audio guide on what they can do on that specific screen. Technology as a service medium is a very new concept to the population that we are talking about. So because they use phone for the communication purposes. So when we are doing that, I'm hoping in general, we will all be responsible to give them access to things which would be helpful rather than make them consumers, I hope. But if we can overcome all these barriers and pay attention to the population, as we're talking about the middle path, there is a chance, there is scope that at the very least to get the information. I'm not talking about the medical services can be provided through this, but at the very least for Bhavani to be able to understand that, oh, maybe I have some condition that I need to do something about it. Or even if it is yeast infection, what can I do sitting at home? Or if we can provide that information, I feel like we would be able to help the quality of life for most of these women. And in conclusion, I want to share with you, it's like a short 1 minute thing. The lady, she's a government, from the government, she's working in the local government, Anganwadis, I don't know if you would know. So you can see what she says, and this is something she chose to do it by herself because we were not even there. And you can see the mic was outside and all, like she just chose to send this feedback to us. So let's hear.
నమస్తే అండి, నా పేరు శ్రీదేవి, సిడిపిఓ భీమునిపట్నంలో పనిచేస్తున్నాను. ICDS లో ఉమెన్ అండ్ చైల్డ్ వెల్ఫేర్ డిపార్ట్మెంట్ లో. ఇది వావ్ అనే వరల్డ్ ఆఫ్ ఉమెన్ అనే యాప్ ద్వారా మా ప్రాజెక్ట్ ఆఫీస్ కి వచ్చి మా అంగన్వాడీ కార్యకర్తలకి, సూపర్వైజర్స్ కి కూడాను వాటి యొక్క ఉపయోగాలు అనేది వివరించడం జరిగింది. ఎక్కువగా మేము పల్లెల్లో ఆడవాళ్ళతోని, కిషోర బాలికలతో, బాలింతలతో వాళ్ళందరితో మేము పనిచేస్తాము. వాళ్ళకి చాలా రకమైన ఆరోగ్య సమస్యలు ఉంటాయి. వాళ్ళు ఏ విధంగా అది సాల్వ్ చేసుకోవాలి, ఎవరికి చెప్పుకోవాలి అనేది చెప్పడానికి సిగ్గుపడతారు. అదే విధంగా హాస్పిటల్కి ఎక్కడికైనా వెళ్ళాలంటే కూడా ఆర్థికంగా కూడా వాళ్ళకి ఇబ్బందులు ఉంటాయి. దానికి పరిష్కారంగా ఏంటంటే వరల్డ్ ఆఫ్ ఉమెన్ ద్వారా మనం ఒక యాప్ డౌన్లోడ్ చేసుకున్నట్లయితే వారి యొక్క సమస్యలు ఏమున్నాయి అనేది వాళ్ళకి ఆన్లైన్ లో సొల్యూషన్ చెప్తారు. వాడికి ఆ ద్వారా కూడా మా వర్కర్స్ కూడా తర్వాత తల్లులు కూడా వాళ్ళకి ఫోన్ చేసి కనుక్కున్నప్పుడు చాలా పరిష్కార మార్గాలు వాళ్ళకి సులువైన మార్గంలో అన్ని కూడా చెప్పడం జరిగింది. ఎటువంటి ట్రీట్మెంట్ ఇవ్వాలి, ఇవన్నీ సొల్యూషన్స్ చెప్పడం జరిగింది. కాబట్టి ఈ యాప్ ద్వారా మన స్త్రీలందరూ కూడా ఈ యాప్ ను వినియోగించుకొని వారి ఆరోగ్య సమస్యల్ని ఏవైనా క్యూర్ చేసుకొని ఆరోగ్యవంతమైన తల్లులుగా, సమాజంగా ఉండడానికి మీ యొక్క సహకారం కావాలని మేము అందరికి కోరుకుంటున్నాం.
That is it.
Make sure that there are questions. Thank you so much. We can open it up for questions online. Yep, thank you. Look, lots of applause online. Wonderful. If you have a question online, you can either use the raise hand function in the reactions button at the bottom of your screen, or you can type into the chat. And we have folks here in the room, so please open it up for any questions, if anyone has any. Up there in the back, yeah.
I'm curious. Thank you for the great presentation, by the way. I absolutely loved your work and thank you so much for doing it. And I was wondering if there were any regulatory considerations that you faced back in India, any barriers on that front for medical information?
I'm going to just repeat the question so that people online can hear. Sorry. So the question was whether there were any regulatory barriers that were encountered in India in doing this work. Sorry, did you have more to that question? No, sorry, go ahead.
That is a great question, because obviously when we are talking about health, it has so many regulations. We did not face any regulatory problems when we were working with the community because we were dealing with healthcare information. How do we get the information to them? We are not like the providers. We are not coming up with some online hospitals or anything like that. How do we bridge? Like the doctors are providing the information. How do we get that information to the population? So it's more like a technological solution to get the providers, and the healthcare providers all have their certificates and everything. So in case if like who gave this, like this doctor. So that's why not yet, but I'm sure if we expand.
Wonderful. It looks like there's a question in the Q&A. Stephanie, can you pull that one up and we'll see? We've got about 5 minutes. Oh, go ahead.
Because I'm logged in here.
Sorry, we're maneuvering around. Maybe. There we go.
Sorry. Yeah, if you click Q&A.
All right. Thanks for the great presentation. Has the issue of a shared cell phone come up? In other words, a single phone for the family, which is then by the husband, and how do you navigate that?
God, that's another great question because it's real. It's a real problem because oftentimes there is only one cell phone that goes around. One of the things that we noticed is in COVID, a lot of schools went online. So for the kids, they had to get a smartphone. not the one that the husband has, because the husband always needs to have their own service. So when they went back to school physically, the kids, they leave their cell phones at home. So then the mothers who were at the bottom of the hierarchy oftentimes, now they have access to that. And also what we have is in the anonymous platform, when they leave us the question, when they hear back, they have the option to delete it. It's not like they need to know, or there is a trace of what they're looking at. It's just like an app. They're just looking anonymous, no details. So that information cannot, meaning I don't think we have ever faced that problem because it's anonymous, because they can delete the information they provide there.
How is the process of engaging doctors in getting them to answer the questions or making videos?
So the question was, how do you engage with the doctors to respond to the questions or to make the audiovisual materials?
So in our anonymous platform, people will leave their questions. And once again, we don't know who these people are. Once we get the question, our reps will get an email that there is a question incoming. So the reps will see the question and they will decide which doctor, because they have the knowledge, like whether it is the gynecologist or whoever that is. And we already have been partnering with a number of doctors in WACh district, because just like us, even they see the gap. Everybody is like, yes, we need to fill the gap, but there needs to be a proper platform to do that. So we have partnered with them. And when we send the questions to them, sometimes they will come up with, we don't know what their age is. We don't know who the person is. So sometimes they will give some information and then ask those questions, which we will send it back. So our reps will make that into a video, because it's audio visual app, send it back to them. And if we ask too many personal details, we did notice sometimes they don't follow up. They don't come back to us, but they'll try to follow the generic information. And we always leave with the caveat that we need this information to be able to share what exactly is happening. So please do, if you can.
Maybe one more, Bala.
Yeah. So I noticed one of the things you mentioned was seeking funding for your project. The reason I'm asking this is why don't you think about a subscription service in terms of the women paying and then you, in terms of sustainability of the app itself?